As states continue to manage the ongoing outbreaks of COVID, they are also in the process of rolling out their supply of vaccines, with some realizing that they're not getting the amount of doses they'd originally planned for. One of those states is the state of Oregon. Joining us now is the Health Director for Oregon, Rachael Banks. Rachael, thanks so much for joining us tonight. Now, today the Oregon Health Authority released its recommendations on who should receive the vaccine first. What are the groups you have prioritized, and do you trust that you'll be able to have all the resources necessary to get this vaccine distributed safely?
Yeah, thank you. So the groups that we've prioritized here in Oregon for 1A start with those workers who are in a hospital setting. So people who work in hospitals, we've really categorized that broadly to include really our values of equity, which so it includes healthcare interpreters, traditional health workers. It includes those people who are cleaning rooms and those people who are delivering food. So our first priority is really that hospital setting. Once again, all workers who work in that hospital setting. To answer the second part of the question, we don't think in this first tranche that we have enough to vaccinate all of those workers. And we know that it'll take longer than we'd like it to.
Now, your state is also going to be receiving thousands fewer doses than originally told by the federal government. Do you know the reason behind the drop in supply, and should residents of Oregon be concerned or feel like they're getting the short end of the stick?
The conversations that we've had for the reasoning really are about wanting to make sure that we have a steady supply, and the federal government wanting to ensure that we have a consistent amount. So saving some of those doses at the beginning so that we can consistently vaccinate people, which I think is important to ensure that we have the second doses that we need once we've begun vaccinating people.
So are you saying you're still going to get the same amount, they're just not giving you as many on the front end?
That's my understanding, yes.
Okay. Now, during a Facebook Live event you held yesterday, you said that you had not received any information for shipments beyond December, and we're more than halfway through the month. How big of a concern is that for you, and are you getting the level of communication and support that's needed?
I mean, we definitely want to have as much information in advance as possible. That helps with planning, and it just helps us to understand how long it's going to take. So I think, you know, we want to see that information as soon as it's available.
Effective today, 29 counties are now under extreme risk. Now, you've said something that you're worried about is the level of hospitalizations. What kind of resources are you deploying at this point to help manage the overload hospitals are dealing with right now?
Yeah, well, first, I just want to say thank you to Oregonians who have been masking, who've been maintaining that distance, who modified their holiday plans and want to see that continue to happen. Some of what's been happening thus far is a reduction of elective surgeries and other procedures so that we can maintain, hospital beds and the staff that go along with them. The other reason that we are prioritizing the hospital setting first to get vaccinated is to really address the concern and what we've seen in terms of staff shortages. So we want to make sure that not only do we have the actual beds, but we have the staff to staff those beds. So those are a couple of the strategies that we're using.
And lastly, you've said before that advocating for health equity has been central to your career. The Pacific Islander community has certainly taken a big hit during this pandemic. What kind of efforts have you led to make sure that this community is reassured that the vaccine is safe and that they will be prioritized?
Yeah, thank you for that question. I mean, there's a number of things. One is that we have been working with community engagement liaisons and community-based organizations, allocated 45 millions to over 170 community-based organizations that include organizations that serve and work with the Pacific Islander community. And we also know that we have to be having spokespeople out. We have to be listening to what the concerns are. Another strategy that we're using is a vaccine advisory committee, and that committee is going to be making decisions about the allocation moving forward. And so we have sought to have representation from the Pacific Islander community and other communities as well, and not just having that, check the box, but that we really are going to be listening to what the needs are and making sure that we are giving all of the information that we have in ways that and languages that people understand.
Rachael Banks, Health Director for the state of Oregon, our thanks to you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.